Good evening. So good evening to all of you. So I welcome you all to the Ultra Rapid Revision course. Topic for today is the diaphragm. Okay, I'll start. Right, so let us start now. Diaphragm. Diaphragm is a muscular organ which separates the thoracic and the abdominal cavities. Okay, the thoracic and the abdominal cavities. What is the origin of diaphragm? Thoraco-abdominal diaphragm, as it is known as. Now, diaphragm has got three sets of origin. There are three sets. One is the sternal head, sternal, which begins from the sternum. The second is the costal head, costal. And the third one is known as the vertebral head, vertebral. So sternal, costal and vertebral. Okay, now we'll discuss these three heads, the origin of the diaphragm. Where does the sternal head begin from? Sternal head, it begins from the xiphoid process. It begins as two slips from the xiphoid process. That's the sternal head. The costal head begins from the inner aspect, from the inner aspect of the lower six ribs, from inside the inner aspect of the lower six ribs. And you have the third head, which is known as the vertebral head. So where does the vertebral head begin from? Have a look at the slide. The vertebral head. So you all know me. I'm Dr. Pradeep Pawar, Professor of Anatomy. What is this muscle? Identify this muscle for me. Yes. This is the psoas major. Right, that's the psoas major. Begins from the lumbar vertebrae, goes down below the inguinal ligament, and it is inserted on the femur, lesser trochanter. What is this muscle which begins from the iliac fossa here? That's the iliacus muscle. Iliacus, which begins from the iliac fossa. Now, next to the psoas major, you've got a quadrangular muscle here, quadrangular muscle of the lumbar region, which begins from the iliac crest and gets inserted into the 12th rib. Begins from the iliac crest, goes to the 12th rib. It's a quadrangular muscle of the lumbar region. We call this as the quadratus lumborum. Quadratus lumborum. Okay, so that's quadratus lumborum. Now tell me, this iliacus is covered by a fascia. What is this fascia known as? The fascia covering the iliacus, and this would be known as the fascia iliaca. Fascia iliaca. Okay, the fascia which covers the iliacus, that's the fascia iliaca. You remember this? The same fascia goes below the inguinal ligament, goes into the femoral region, and forms what? The same fascia iliaca which covers the iliacus muscle goes below the inguinal ligament, comes in the femoral triangle, forms the posterior wall of the femoral sheath. Posterior wall of the femoral sheath. Okay, that's fascia iliaca. Now this fascia iliaca, the same fascia iliaca, now covers what? Look at this one moment. It now covers this muscle. That's the psoas major. The same fascia iliaca now covers the psoas major. It is now known as the psoas fascia. Psoas fascia. So what is psoas fascia? Psoas fascia is the same fascia iliaca. The fascia iliaca which was covering the iliacus now covers the psoas major. We now call it as the psoas fascia. And as we go up here, this fascia becomes thick, extends from the body of L1 to its transverse process, from the body of L1 to its transverse process, and this is what we call as the medial arcuate ligament. The medial arcuate ligament. So what is medial arcuate ligament? It's a thickening of the psoas fascia. extends from the body of L1 to its transverse process. Okay, that's the medial arcuate ligament. Fine. Now what is this muscle next to the psoas? That's the quadratus lumborum, right? And this quadratus lumborum is covered by two fascias. Two fascia covers the quadratus lumborum, and this is what we call as the thoracolumbar fascia. Thoracolumbar fascia. Now quadratus lumborum has got an anterior surface and posterior. The one which covers the anterior surface of quadratus lumborum is known as the anterior layer of thoracolumbar fascia, anterior layer, and the one which covers it from behind is known as the posterior layer of thoracolumbar fascia, posterior layer. Okay, so one which covers it from front, anterior layer of thoracolumbar fascia. The one which is behind is the middle layer. It's not posterior, it's the middle layer. Middle layer of thoracolumbar fascia. What is the, so there has to be one more, posterior layer of thoracolumbar fascia. Yes, and what is the posterior layer of thoracolumbar fascia cover? Any idea? Yes, anyone? Can you tell me? The posterior layer of thoracolumbar fascia covers what? There's a muscle at the back which begins from the spine to the transverse processes of the lumbar vertebrae. Anyone? Begins from the spine, goes to the transverse process of the lumbar vertebrae, and this is what we call as erector spinae. Erector spinae. So the one which covers the erector spinae is known as the posterior layer of thoracolumbar fascia, right? So we have got three layers of thoracolumbar fascia. One is the anterior, which covers the anterior surface of quadratus lumborum. One is the middle layer, which covers the posterior surface of the quadratus lumborum, and the third is the posterior layer of thoracolumbar fascia, which covers the erector spinae muscle, erector spinae. Now as we go up, this fascia becomes thick. The anterior layer of thoracolumbar fascia becomes thick, extends from the transverse process of L1 to the 12th rib, extends from the transverse process of L1 to the 12th rib, and this is what we call as, yes, anyone? This is what we call as, look at this, what is this? This is what we call as the lateral arcuate ligament, the lateral arcuate ligament. What is this ligament? This is the medial arcuate ligament. So medial arcuate ligament, lateral arcuate ligament. Why am I telling you all this? Because all this is going to give origin to the diaphragm. This will all give origin to the diaphragm. Plus, the diaphragm also arises from the bodies of the lumbar vertebrae. Look at that. On the right side, it arises from the bodies of L1, L2, L3 lumbar vertebrae. On the left side, it arises from L1, L2 bodies of the lumbar vertebrae. And this is what we call as the crus of the diaphragm, or the crura of the diaphragm, So all this becomes what? The vertebral origin of the diaphragm, vertebral origin. Okay, I'll just make a slide for you. So origin we classify into three groups. One is the sternal. Okay, I'll just write it like this: sternal. One is the costal, and the third one is the vertebral. Sternal, costal, vertebral. So sternal head begins from where? Sternal head begins from the xiphoid process. Right. The costal head. Where does the costal head begin from? It begins from the inner aspect of diaphragm. Is very important. Inner aspect of lower 6 ribs. Inner aspect of the lower 6 ribs. And where does the vertebral head begin from? The vertebral head arises as the right and the left crus. The vertebral head arises as the right and the left crus. The medial arcuate ligament, and this medial arcuate ligament is a thickening of psoas fascia. The medial arcuate ligament, that's a thickening of psoas fascia, and the lateral arcuate ligament, that's a thickening of the anterior layer of thoracolumbar fascia. Okay, lateral arcuate ligament, that's a thickening of anterior layer of thoracolumbar fascia. I'm not writing that for you. So this becomes the origin of the diaphragm. Origin. Now, where is the insertion? Tell me now. The anterior head, the sternal head, begins from the sternum, comes backwards. It comes backwards, but towards the center. The costal head begins from the ribs, the inner aspect, and comes towards the center. and the vertebral head begins from behind and comes towards the center, and here it converges to form what is that known as? The central tendon of the diaphragm. Very good. Here it forms the central tendon of the diaphragm. Clear? So that's the insertion, that's the central tendon. Okay. Now what are the openings in the diaphragm? Openings, if you can just tell me the openings in the diaphragm. One moment. Okay. What are the openings in the diaphragm? One is at T8. Answer this. What is T8? What opens at T8 vertebral level? That's the IVC and the right phrenic nerve. IVC and the right phrenic nerve. At T10, it's the esophagus with the right and the left vagus. Esophagus with the right and left vagus. T12 is the aorta. Yes, aorta. Very good. You all know this. I'm just aorta. What else? Azygous vein and the thoracic duct. Okay. So T12 opens the aorta, azygous vein, and the thoracic duct. This is all you know. Now tell me, there's something which comes. One moment. Yes, very good. Now see this slide and tell me, have a look at this. Now what is this? Once again, just quickly answer this now that you all know this. Yeah, that's a medial arcuate ligament. What's that? Lateral arcuate ligament. And there's someone who comes below the lateral arcuate ligament. What's this structure? If you can answer this. There's someone who comes in the abdomen behind the lateral arcuate ligament. What is this? Answer, come on. What is this structure? This is the subcostal nerve and vessels. Who comes in the abdomen behind the lateral arcuate ligament? That's the subcostal nerve and vessels. What is subcostal nerve? Subcostal is T12, the ventral ramus of T12. Below the 12th rib, there's no rib, so we don't call this as intercostal nerve. It lies below the 12th rib, we therefore call this as the subcostal nerve. So who enters the abdomen behind the lateral arcuate ligament is the subcostal nerve and vessels. And who enters the abdomen behind the medial arcuate ligament? Look at that. What is this chain here? That's the sympathetic chain, right? So that's the sympathetic chain which enters the abdomen behind the medial arcuate ligament. And if you can just see the slide, you tell me someone is going to pierce this crus of the diaphragm. Look at that. Someone is going to pierce the crus of the diaphragm and come inside the abdomen. If you can tell me who's that. I've pointed that for you. Someone is going to pierce the crus of the diaphragm. You can see that, no? I've pointed that for you. Here it is. Yes, tell me who's this structure? Who's going to pierce the crus of the diaphragm and come into the abdomen? Answer. Yes, these are the splanktonic nerves. Very good. These are the splanktonic nerves. We have got three splanktonic nerves. The greater splanktonic, the lesser splanktonic, and the least splanktonic, right? Three splanktonic we have: greater, lesser, and the least splanktonic nerves. Now, what are these splanktonic nerves? What are these splanktonic nerves which pierce the crus and they come into the abdomen? Yes. See, sympathetic nervous system, what is the outflow? It is thoracolumbar outflow. That means where does the preganglionic fiber begins from? It begins from the thoracic and the lumbar segments of the spinal cord. They begin from T1 to L2. They pass through the ventral root. They enter the spinal nerve. The preganglionic fibers enters the spinal nerve, and now they go to the sympathetic ganglions. Through, what is that? How do they enter the sympathetic ganglions? The preganglionic fibers. Yes, anyone? Can you answer this? They begin from the spinal cord, they pass to the ventral root, they enter the spinal nerve, and now they go to the sympathetic ganglions through white ramus communicans. Okay, so the preganglionic fibers enters the sympathetic ganglions through the white ramus communicans. They will relay in this ganglion, and what begins from this ganglions would be the postganglionic fibers, and the postganglionic fibers would be given to the spinal nerves. And how do the postganglionic fiber reach the spinal nerve? Once again, through the gray rami communicans, okay. So the preganglionic fibers enters the sympathetic ganglion, relays here, and the postganglionic fibers go through the gray rami communicans and they go to the respective sites. Now that's fine, but some fibers do not relay in the ganglions. The ones which do not relay in the sympathetic ganglions, they emerge out of the sympathetic ganglions as the splanchnic nerves. Splanchnic nerves. So this would be preganglionic fibers only, because they have not relayed in the ganglions, right? So this would be the preganglionic fibers. So from T5 to T9, thoracic sympathetic ganglions, the fiber which emerges, this is known as the greater splanchnic nerve. From T5 to T9, that's greater splanchnic. T10, 11 ganglion, that's the lesser splanchnic, and T12 is the least splanchnic nerves. They do not relay in the sympathetic ganglions, so they emerge out as the preganglionic fibers. Is this clear to all of you? So how many splanchnic nerves? The 3 splanchnic nerves: greater splanchnic, lesser splanchnic, and the least splanchnic nerves. Okay, and how do they come into the abdomen? They pierce the crust of the diaphragm. The greater and lesser, they pierce the crust of the diaphragm, and now they come into the abdomen. In the abdomen, what is this? This is the aorta. And what is this big artery here? That's the celiac trunk. Yes, and around the celiac trunk, you've got this celiac ganglions. So the preganglionic fiber, the splanchnic nerves, will relay in the celiac ganglion and form a plexus here. And what is this plexus? Known as the celiac plexus. This is what we call as the celiac plexus. Okay, and where is the location of this celiac plexus? It is anterolateral to the aorta. It's on either sides. Anterolateral to the aorta is the location of celiac plexus, and from this celiac plexus, the postganglionic fibers would begin, and they would go to supply the GIT. Okay, that is the nerve supply of the GIT, the sympathetic nerve supply. So I was just telling you, what comes below the lateral arcuate ligament is the subcostal nerve. What comes below the medial arcuate ligament, that's the sympathetic chain, and what pierces the crust, these are the splanchnic nerves. Splanchnic nerves. This is clear to all of you? Yes. Okay, so this is about the origin, this is about the insertion, and these are the openings in the diaphragm. Openings in the diaphragm. So this slide is clear to all of you, no? Okay, the diaphragm is a very important topic. That is why I've selected this. Now something about the development of diaphragm. Okay, if you can, diaphragm, the topic is diaphragm, but I've just told you something about the splanchnic nerves and how do the splanchnic nerves come into the abdomen. Okay, so the topic is diaphragm. Yes. Okay, fine. Now regarding the development of diaphragm, tell me, what is the main contribution in the development of diaphragm? Main contribution. See, when the embryo is folded, I'll just make this slide for you. I'll just make this slide, one moment. When the embryo is folded, what is the first thing on the ventral aspect? The first thing on the ventral aspect, that's the septum transversum. Okay, I'm just drawing a folded embryo for you. That's the septum transversum, and this septum transversum is going to form the future diaphragm. Next to the septum transversum is the developing heart. The developing heart, or this is what we call as the cardiogenic area. Sorry, just one moment. Okay, so the first thing on the ventral aspect is the septum transversum. Next is the developing heart. We call this as the cardiogenic area. Next to this is the procaudal plate. Procaudal plate, or the future, what is that? The future mouth. It is also known as the buccopharyngeal membrane. The procaudal plate or the buccopharyngeal membrane, that's the notochord. And what is this about the notochord that we have? What is this? Anyone? What is this about the notochord? That's a neural tube. That's a neural tube. That's the primitive streak. That's the primitive node. And this is the cloacal membrane. Cloacal membrane. And what is this going to be? That's the amniotic cavity. And what is this going to be? That's the yolk sac. Yolk sac. And this is the yolk sac, which is incorporated inside the embryo, and this is a small comma shaped structure. What do you call this? As the Iliacus or the allantois. Okay, so I just want you to know the septum transversum. Where is the septum transversum lying? On the ventral aspect of the embryo, ventral aspect, and this septum transversum is going to form the future diaphragm. The major part of the diaphragm is formed from the septum transversum. So the first contribution to the formation of the diaphragm is septum transversum. Clear? Now, you tell me, the entire GIT, this is the GIT, and how would the GIT remain as a tube inside the embryo? The embryo is folded like this, the GIT would fall down, otherwise it would fall down. The GIT is suspended from the posterior abdominal wall by the dorsal mesentery. So there's a dorsal mesentery which is holding the GIT to the posterior abdominal wall. Okay, dorsal mesentery. Now we are with the esophagus. What is this with regards to the esophagus? That would be the dorsal mesentery of the esophagus. Dorsal mesentery of the esophagus. So second contribution to the diaphragm is the dorsal mesentery of the esophagus. The third contribution is by the body wall. The entire body wall takes part in the formation of the diaphragm. This is the body wall, the entire body wall. Okay, so the main contribution to the formation of diaphragm is septum transversum. Second is the dorsal mesentery of the esophagus. Third is the body wall. And tell me, how are these body cavities formed? The body cavities, all the body cavities, the pleural, the peritoneal and the pericardial cavities. How do you get these cavities? Just one moment, I'll tell you this also. Now you tell me, what is this first? We have got 3 germ layers in an embryo. I am Dr. Pradeep Pawar, my child. I am Dr. Pradeep Pawar. So the upper layer is ectoderm, the middle is mesoderm, and the lower one is endoderm. These are the 3 germ layers in an embryo. And you know who's going to form all these 3 germ layers? Yes, if you can answer that. Who forms all these 3 germ layers? Yes, Rashti. Who forms all these 3 germ layers? Yes, tell me fast. Ectoderm, mesoderm, endoderm. In the embryo, who forms all these 3 germ layers? Come on. Yes, this is the epiblast. Yes, the epiblast forms all the 3 germ layers. Very good. The epiblast forms all the 3 germ layers, or the epiblast enters the primitive streak, gets modified and forms all the 3 germ layers. So whether you say epiblast or whether you say primitive streak, it's the same. Okay, so these are the 3 germ layers which are formed by epiblast or primitive streak. So ectoderm, mesoderm, endoderm. So what is this mesoderm inside the embryo known as? This is what we call as the intraembryonic mesoderm. This is the intraembryonic mesoderm. And who's going to form this? Epiblast. Okay, and we had an extraembryonic mesoderm also, which was outside the embryo. And who forms this extra embryonic mesoderm? If you can answer this. Yes, dear, you recognize me. Yes, who forms this extra embryonic mesoderm? Answer this. Extra. Intraembryonic mesoderm is formed by epiblast. Yes, who forms the extra embryonic mesoderm? Answer, my dear children. What did you know? You answer. Who forms the extraembryonic mesoderm? That's the yolk sac, or you can say the hypoblast. Okay, so yolk sac or the hypoblast. Fine, we'll come to that later. So this is the intraembryonic mesoderm, and in this intraembryonic mesoderm, who's this in the center? That's the notochord. Or the notochord process that forms the future notochord, which disappears later. Okay, forms the nucleus pulposus and the apical ligament of dens. So this notochord is present within the mesoderm. The first thing on either sides. Now the mesoderm gets differentiated into, what is this first one? This is the paraxial mesoderm. The second one, what's that? This is the intermediate plate mesoderm. And the third one, this is known as the lateral plate mesoderm. Okay, so the intraembryonic mesoderm gets differentiated into a paraxial and intermediate plate and a lateral plate mesoderm. And in this lateral plate mesoderm, we get the formation of a cavity here. And a cavity is known as what? Coelom, formed inside the embryo. We therefore call this as the intraembryonic coelom. So this intraembryonic coelom is formed in the lateral plate mesoderm. Okay, and this intraembryonic coelom is going to give rise to all the body cavities. Yes, dear, just wait, let me finish this. So this intraembryonic coelom gives rise to all the body cavities, the pleural, the peritoneal and the pericardial cavity. So tell me, if that's the embryo, if this is the head and this is the tail, okay, this cavities are continuous with each other. That means if this is the thorax and this is the abdomen here, thorax and abdomen, okay, this is the head and this is the tail, thorax and abdomen. So this body cavities, the pleural cavity is continuous with the peritoneal cavity. The pleural cavity of the thorax is continuous with the peritoneal cavity, and now we get a membrane here, a membrane. And what is this membrane known as? The pleuroperitoneal membranes. And this pleuroperitoneal membranes is going to separate the pleural cavity from the peritoneal cavity. Okay, pleural from the peritoneal cavity. Just see if you can understand the slide. How's this view? Tell me, how's this view? Where is this view taken from? I'll just clear this for you. Okay, pleuroperitoneal membranes, very good. How is this view taken? This is an embryo. No, the embryo is folded like this. The embryo is folded. The section is taken like this, like this. So if this is the embryo which is folded, what is this aspect for the embryo? Dorsal, dorsal. And what is this aspect below? Ventral. So this is dorsal and this is ventral. Okay, so this is a, yes, a section, a coronal section, right? So dorsal ventral, and this is the ventral aspect. This is the septum transversum on the ventral aspect. That's the dorsal mesentery of the esophagus, and this is the pleuroperitoneal membranes. Pleuroperitoneal membranes. So what is the cavity in front now? In front, pleural, and what's the cavity on that side? On the opposite side, that will be the peritoneal cavity, and this is what we call as the pleuroperitoneal membranes. A very, very important thing for you, development of diaphragm. Okay, so what does it form? That also I'll tell you, starting with this septum transversum. Septum transversum. So what does it form? Yes, answer this. We've just discussed this today only. Septum transversum forms what? The central tendon of the diaphragm. Central tendon. Now you know what is a central tendon and who passes through the central tendon, the IVC. Okay, so septum transversum forms the central tendon. The pleuroperitoneal membranes. Yes, very good. Pleuroperitoneal membranes. And what do they form? They form the posterior part of, very good, posterior part of central tendon. Posterior part of central tendon. Then is the dorsal mesentery of esophagus. Dorsal mesentery of esophagus. And what is the dorsal mesentery of esophagus forms? The crus of the diaphragm. The crus, the right and the left crus. And the last one is the body wall. And what is the body wall form? The peripheral parts. Very good. The peripheral part of the diaphragm. So just remember all this. Which part gives rise to what? So this is just going to form the structure. Only the structure of the diaphragm is formed here by this thing. Where do the muscles come from? You know, all the skeletal muscles in the body are derived from the paraaxial mesoderm. Now I told you the paraaxial, the intermediate plate and the lateral plate. So all the skeletal muscles would be derived from the paraaxial mesoderm. The paraaxial mesoderm forms what is known as the somites. Somites, okay. This paraaxial mesoderm forms somites and the muscles are derived from somites. Now which somites forms the muscles of the diaphragm? So muscles of the diaphragm are derived from cervical somites, or you call it as myotomes. Okay, very good. Cervical somites or cervical myotomes. Is this clear to all of you? So that's about the diaphragm. I've told you the development of diaphragm. I've told you the cross of the diaphragm. Now, arre beta, you attend the other lectures also, you will understand. Okay, so now myotome will form the muscles, right? Fine. Now you tell me, if this pleuroperitoneal membranes do not fuse, have a look. If this pleuroperitoneal membranes do not fuse here, if they don't form, if they don't close here, there will be a gap. There will be a gap in the diaphragm, and this gap will be posterior and lateral. A posterolateral defect in the development of diaphragm due to non-fusion of the pleuroperitoneal membranes is known as what? Bochtelic's hernia. Very good. That's Bochtelic's hernia. Yes. So it is due to non-fusion of the pleuroperitoneal membranes. Okay, a posterolateral defect in the development of diaphragm, that is known as Bochtelic's hernia. Now tell me, there's a gap in the diaphragm. So who's going to herniate up? There's a gap, so someone has to herniate up, right? Otherwise, what's the use of the gap? Tell me, who's going to herniate up into the thorax? Answer. I'm just waiting. Answer. Yes, if there's a Bochtelic's hernia, and this Bochtelic's hernia is more common on which side? Bochtelic's hernia is more common on which side? Yes, answer. Bochtelic's hernia is more common on which side? Fine. The abdominal contents, they go up, right? The intestines go, the spleen goes, The stomach goes, Boctalix hernia is common on the left side. Very good. It's more common on the left side. The spleen goes, the transverse colon goes, the intestine goes, the omentum goes. But the most important organ which goes up into the thorax are the kidneys. Kidneys. You know, where are the kidneys formed? If anyone can tell me, where are the kidneys formed? To begin with, the kidneys are formed in the pelvis, right? Kidneys are first formed in the pelvis, because kidneys are derived from that nephrogenic ridge, the pronephros, the mesonephros, and the metanephros. You know, the pronephros goes off, the mesonephros goes off. What remains in us, which is functional, is metanephros, right? And this metanephros is there in the pelvic region. So therefore, the kidneys are formed in the pelvic region. Yes, kidneys are first formed in the pelvis from the metanephros. And you know, when the kidneys are formed, where is the hilum facing? The hilum is facing forwards like this, anterior. The hilum is facing anterior. And now the kidneys will start to ascend up. The kidneys begin to ascend up. Why do the kidneys ascend up? There are two theories given for this. One is the differential growth of the body wall. The body wall grows very fast. So automatically the kidneys are pulled up, and then the hilum faces medially. That's the final position. The second theory given is the kidneys require a high pressure for filtration of blood. They require a high pressure. So when they are in the pelvis, the pressure which they get from the heart is too less. They need a higher pressure. And that's how they start to ascend up. They start to ascend up. They come up. That's the diaphragm here. And here the pressure for filtration of blood is adequate. Now the hilum faces medially. Okay, that's how we see the final kidneys in us. But suppose if there's a gap in the diaphragm, the kidneys would always enter the thorax and lie on either sides of the heart, where pressure for filtration of blood would be maximum, right? Understood. So that's about the Boctalix hernia, a posterolateral defect in the development of diaphragm. Right. There's one more defect in the diaphragm. You know, the sternal head and the costal head of the diaphragm. Where does the sternal head begin from? Xiphoid process. And where does the costal head begin from? The ribs. Between the sternal and the costal head, there's a small gap there. Answer. There's a small gap between the sternal and the costal origin. There's a small gap in the diaphragm. Anyone? Yes, that's the foramen of Morgagni. Or this is what we call as the space of Larry space. Foramen of Morgagni or the space of Larry. And normally, who passes through this space? Answer. There's someone who goes in through this space. Yes, who's that? Who enters through this space? Normally, I'm telling you. Yes, who enters through this space? There's an artery. Answer. There's an artery which comes from the thorax into the abdomen. Who's that artery? Superior epigastric, right? That's the superior epigastric artery. Very good. And this superior epigastric artery is a branch of internal thoracic artery. And this superior epigastric artery enters the space of Larry or the foramen of Morgagni, comes in the abdomen, and anastomoses with the inferior epigastric artery. It anastomoses with the inferior epigastric artery in the rectus sheath. Right. So that's about the foramen of Morgagni or the space of Larry. Clear to all of you? Anywhere else have you come across sinus of Morgagni? Anywhere else have you come across this term Morgagni? Chalo, answer this. If you can answer this. Anywhere? This term Morgagni. So one is the sinus of Morgagni. One is the foramen of Morgagni, which is there in the diaphragm. Yes. Tell me. Anywhere else? In the neck. Yes, where? So that's about the diaphragm. I'm just asking you some questions. So I've finished with the diaphragm. I've told you the origin, insertion, the openings in the diaphragm, and I've told you the development of the diaphragm and some applied anatomy. Okay, very good. Akshit, it's between the superior constrictor and the base of the skull. The superior constrictor and the base of the skull. That's that's known as the sinus of Morgagni. Anywhere else have you come across Morgagni? Anywhere else other than the base of the skull, if you can tell me that. Anywhere else have you come across? Anything like columns of Morgagni? Yes? Columns of Morgagni? Guess. Anywhere else is the columns of Morgagni. So this Morgagni is a very important term. Columns of Morgagni. Yes, anyone? I'm waiting. Columns of Morgagni are in the anal canal. Anal canal, the columns of Morgagni. And if you join the lower end of the anal columns or the columns of Morgagni, you get a wavy line. What is that line? Dentate line. That's about the dentate line. That was the dentate line. Okay. So that's about the Morgagni. So this is about the diaphragm. Tell me, hiccups, if we get hiccups, this is due to irritation of the phrenic nerve. The phrenic nerve supplies the diaphragm because the muscles of the diaphragm are derived from cervical myotomes. So the nerve from the neck comes down to supply the diaphragm. Okay. Yes, the nerve from the neck comes down to supply the diaphragm. That's phrenic nerve, phrenic. And if you can just tell me, what is the root value of phrenic nerve? Quickly, I'll just tell you the phrenic nerve. Yes, very good. What is the root value of phrenic nerve? Root value. Answer. What is the root value of phrenic nerve? Come on, fast. The phrenic nerve comes to supply the diaphragm. How does the phrenic come to supply the diaphragm? I'll just tell you. C3, C4, C5. Very good. The root value of phrenic nerve is C3, C4, C5. And this phrenic nerve lies on a muscle in the neck. What muscle is that? Yes, what muscle is that? On which it lies? The phrenic nerve. Come on. You know this. Just try to recollect. The phrenic nerve lies on which muscle? Yes. It lies on the muscle of the neck. The muscle is behind the sternocleidomastoid. Who's that? Scalenus anterior, right? So the phrenic nerve is lying on the scalenus anterior, and the phrenic nerve is plastered to the scalenus anterior by a fascia. That is the prevertebral fascia. So the prevertebral fascia is going to cover the phrenic nerve. That means the phrenic nerve is in direct contact with the scalenus anterior. Now this phrenic nerve comes on the scalenus anterior. It comes at the root of the neck. It enters the thoracic inlet. Okay, it enters the thoracic inlet. It lies in the mediastinum. Superior mediastinum. Then it goes in the inferior mediastinum. Inferior, it goes in front of the hilum of the lungs. Right? It goes in front of the hilum of the lungs, and the right phrenic nerve now enters the abdomen along with the IVC. So the right phrenic nerve goes into the abdomen along with IVC at T8, and the left phrenic nerve directly, it is going to pierce the crus of the diaphragm and enter into the abdomen and supplies the diaphragm from the abdominal aspect. Okay, so that's how the phrenic nerve is going to supply the diaphragm from the abdominal aspect. Clear? So I've told you the phrenic also in addition to this diaphragm. Okay, so that's hiccups you get due to irritation of the phrenic nerve. You can get a shoulder tip pain. Why? Because the root value of phrenic nerve and the supraclavicular nerve, which supplies the shoulder, is the same. C3, C4 and C5. C3, C4, C5. Okay. And when we breathe in, which diameter of the thorax gets increased? When we breathe in, the diaphragm goes down. So it increases the vertical diameter of the thorax. It increases. Okay. So that's everything about the diaphragm. I'll just brief you about our regimen batch sign is different. Okay, so this is the plus subscription that we have, in which you have got daily live classes, the live quizzes, the structured courses, and unlimited access to the materials that we provide. We've got an iconic subscription where you get the best of the Unacademy lectures and the pre-planned notes. Okay. This is a limited time offer in which the prices are further slashed down. Now you get 3 months of subscription and 1 month free with 3 months of subscription, and you get 2 months of subscription free on 1 year. Okay, I'll tell you, just wait. So if you buy a 1 year subscription, you get 2 months free. And yes, we have now started with NEET PG seasons batch from 26th of May. We have started with Target Next. Okay, and we've got some 34,000 curated MCQs. You download the Unacademy app. We've also started with the first professional courses. We have started. Okay. Yes, we've now started with the first prof courses. We've also started with the second prof courses. first prof, the second prof, yes, and the third prof also. We've started also with the third prof courses. Yes. Yes, now what were you asking me? Superior epigastric artery is a branch of, yes, but superior epigastric artery is a branch of what? Anyone? Superior epigastric artery is a branch of, yes, if anyone can answer this. Class was at 6:15. Superior epigastric artery is a branch of internal thoracic artery. The superior epigastric artery is a branch of internal thoracic. It enters the abdomen through the space of Larry or the sinus of Morgagni, and it anastomoses with the inferior epigastric artery, which is a branch of, no, not gastroduodenal, inferior epigastric artery. Hey, gastroduodenal artery is inside the abdomen. It's inside the abdomen. This inferior epigastric would be a branch of external iliac. Inferior epigastric is a branch of external iliac. Yes, dear. What is regimen badge sign? Regimen badge sign is because of the injury to the axillary nerve. The person complains of a loss of sensations on the lateral aspect, upper lateral aspect of the arm. Okay, so that is what we call as regimen badge sign. Regimen badge sign. It's loss of sensations of the skin on the upper lateral aspect of the arm. Upper lateral aspect of the arm. So that is what we call as regimen badge sign. Regimen badge sign. Okay. So that's regiment badge sign. Numbness in the lateral part of the deltoid. Yes. Right. Anything else? Any other doubts that you have? Just tell me. Okay. Anyone else has any other doubts? Superior epigastric is clear. Inferior epigastric is clear. You can tell me what is superficial epigastric artery. I finished with the topic diaphragm. What is superficial epigastric artery? Like you've got a superior epigastric artery, which is a branch of internal thoracic. You've got a superficial epigastric artery, which is a branch of. Answer this. So I'm just asking you some questions. I've finished with the topic. Yes. Tell me, superficial epigastric artery is a branch of femoral. Very good. So superficial epigastric artery is a branch of femoral. Very good. It's a superficial branch of femoral artery. Superficial branch of femoral artery. So you've got the superficial epigastric vein. Where would it drain into? A superficial epigastric vein would drain to what? Femoral vein. Yes. Do you agree to this? You've got the superficial epigastric artery, which is a branch of femoral artery. So the superficial epigastric vein would drain into what? Yes, my dear children, answer. Superficial epigastric vein would drain into, not femoral vein. It doesn't drain into femoral vein. It drains into some other vein, which further drains into femoral. Who's that? Great saphenous vein. Great saphenous vein. Yes, dear, I got it. Great saphenous vein it drains into. One class on neuroanatomy. Okay. Neuroanatomy. Fine, I'll take one class on neuroanatomy. I've got 2 more classes of YouTube scheduled for this month. So one I'll take a image based revision and one I'll take on neuroanatomy. Internal mammary artery is internal thoracic, bache. Internal thoracic artery. Internal mammary is internal thoracic artery, which is a branch of first part of subclavian artery. Okay. It's a branch of first part of subclavian artery. Yes. Any specific thing about neuroanatomy that you want? Yes, Trusty. Any specific class on neuroanatomy? I'll take one lecture on neuroanatomy on YouTube. You suggest what you want. You can tell me if anything specific you want. Okay. Foramens of the skull. Foramens of the skull. I normally also take that in lectures. Yes, the rest of you can tell me sections, bache. Okay. Sections. Cerebellar pathways. Perineal pouches. Perineal pouches is a big topic, my child. I'll tell that somewhere. Perineal pouches. Okay, I'll keep this in mind. How about the cranial nerves? Okay, I'll tell you the brainstem later, huh? I'll keep a lecture. Yes. The main syndromes you need to know: the Weber syndrome, Weber syndrome. Then you have to know the lateral medullary syndrome, the medial medullary syndrome. Yes. And the one in case of Pons. Housemaid's knee is the inflammation of prepatellar bursa. Housemaid's knee is the inflammation of prepatellar bursa. And clergyman's knee is the inflammation of infrapatellar bursa. Clergyman's knee is the inflammation of infrapatellar bursa. Housemaid's knee is prepatellar bursa. Okay. Suboccipital triangle. You had told me. Yes. I'll just note it down. Suboccipital triangle. Fine. Okay, I'll tell that. I'll take the lecture on that. Don't worry. Okay, fine. So I hope everything is clear to all of you. The diaphragm is perfect. The origin, insertion, nerve supply, actions of diaphragm, the embryology of the diaphragm, and the defects, embryological defects of the diaphragm. Okay. So this is about the diaphragm. What I told you. I've also told you the course of the phrenic nerve and the rest of the things, whatever was related to it. Okay. Thank you to all of you. Thank you. Thank you. Thank you. Thank you very much. Thank you so very much. Thank you. Median arcuate ligament covers the aorta. Aorta passes through it. Aorta. The median arcuate ligament, the aorta passes through it. Okay. Aorta. That's lateral, medial, and then median. Median. And what passes through it is the aorta. Okay. Akshit. Thank you.